to find a vaccine for the virus. And yet, in the meantime, through all of this, the business of going on with life in the new normal and earning a living in the same new normal needs to go on in the best possible way. Prime BMD, the construction arm of the Razon Group, prides itself in the infrastructure work that it does. We have deep domain expertise and experience in the development of seaports, airports, roadways, rail systems, and other similar infrastructure projects. In our very short history in the Philippines, we have participated in key infrastructure projects that help the country achieve its development goals. And while we have relied on mega, large-scale physical infrastructure projects to underpin our business and growth, we were greatly honored to have been able to participate in this project in collaboration with architect Dan Lichauco. We'll talk about the project in a little bit detail later. Prime BMD has now delivered over 1,000 beds across 6 facilities for the fight against COVID. This facility we inaugurate today is the largest to date in the country. We are very proud to be involved in the fight against COVID and to be able to deliver this facility for the government on behalf of the Bloomberry Cultural Foundation. The Razon Group, through this Bloomberry Cultural Foundation, has now funded 3 quarantine facilities for the IATF, totaling about 850 beds. So this includes Ninoy Aquino, Rizal Memorial, and this current one, as well as helping put up 3 mass testing facilities in support of the ongoing fight against COVID-19. When the call was made to build these facilities, we had no question in our collective minds about diving headlong into the job and doing the best we could. We are grateful to be a partner to government in the building of these facilities. The planning, sourcing, and execution of this project entail the same intensity as required for other mega projects. Our teams worked tirelessly for 5 straight weeks, 24/7, including Sundays, to get this completed by target date. Under the able leadership of the folks on the ground, Josfer Melihor and Aprilan Fernandez, we were able to deliver as promised, and that makes us very proud. And we did it safely too, adhering to our group zero harm policy. But this is a team sport, and we would not have been able to accomplish this without the different government agencies that work tirelessly to make this happen, including the IATF, DPWH, DOD, DPWH, DOH, BCDA, Armed Forces of the Philippines, OCD, MMDA, and others. We would also like to mention and thank service providers Meralco and Maynilad for their cooperation and support in fast-tracking the connections, the service connections needed for this facility, as well as our other suppliers and subcontractors who provided materials and manpower. To the Prime BMD staff and workers who responded to the request on short notice to deliver the facilities under grueling and strict COVID protocols and ensuring prevention and control was paramount during construction, we salute you as well and thank you for a job well done. The collection of people working efficiently to erect this facility truly demonstrates the heal as one mentality that is important to successfully combat the virus. So in ending, let's just start putting this facility in good use and get on the business of building the country. Thank you and have a good day.
Thank you very much, Mr. De Dios. At this point, to give us the overview of the facility, we would like to welcome the founding partner and principal architect of the Archon Architects, Architect Dan Lichauco.
Thank you very much. Good morning, Secretary Lorenzano, Secretary Dizon, USEC Sadayan, and of course, we're waiting for Secretary Roque, and Chairman De Jos from Prime BMD. First of all, I'd like to say thank you very much for giving us the opportunity to, again, serve and help with the COVID pandemic. Just to let everybody know, this is our 14th facility from the firm, right, which includes quarantine facilities as far as Quezon province, and full testing laboratories, and about to complete a fully operational from zero COVID or multi-disease isolation ward for PGH. So we're actually very happy to help, and this is the biggest I think, and one of the most challenging facilities that we actually built. I'd like to say thank you very much and congratulations from Prime BMD. As an architect, I wish all our contractors were as proactive, right, as the group. And it is a testament to the organization that we can actually finish this facility in record time. I'd like to also thank DPWH for their support as well. And with the agencies working together, we're sure that with this facility will be used, but hopefully not for long. I'd just like to greet Secretary Roque. Good morning. Now, just to explain, the facility is divided into two areas. We have the clean zone, which is in front, and then the hot zone, which houses the beds. No? What is nice about this space is that it is basically an open-air facility that will allow us to properly dilute the virus in the open air, which is a far better method of quarantining and containing the virus as opposed to enclosed facilities. The enclosed facilities are facilities that we had to do with, but the fact that this is open air that allows the people to move around, are very comfortable, allows the patients to get sunshine, right, and produce vitamin D, which is part of the curing of the disease. We're pretty confident that this will be one of the more successful units in terms of prevention of cross-contamination and containing the virus within its compound. This is designed for mild to asymptomatic patients, and part of the facilities will include a clinic so that if the patient's symptoms progress, they can be isolated in the clinic and eventually sent out to the hospitals, to the partner hospitals. It has full back of the house facilities, including security tents, quarters for the staff, and full toilets that are way above the ratios of toilets and showers to people than the National Plumbing Code of the Philippines. So we designed this in such a way, knowing that the Filipinos actually take a lot of showers, they want to wash their own clothes, they want to have a certain amount of independence while in the facility. We have overloaded the showers and toilets and laundry facilities and hand washing sinks to be way above the code of the Philippines. So we're pretty confident that this facility will be used, hopefully not for long, right? And again, thank you very much for giving us the opportunity to help and serve. Thank you very much.
Thank you very much, Architect Lichauco, sir. At this point, we would like to hear the message from Secretary Delphine Lorenzana, Department of National Defense, National Task Force Against COVID-19 Chairman.
Secretary Roque, Secretary Vince, Undersecretary Emil Sadayan of the DPWH, Mr. De Dios, and Architect Lichauco. Ladies and gentlemen, good morning. I still remember when we started the IATF sometime in March, and we took stock of our facilities, and we found out how woefully inadequate those facilities were. I still remember that we only had one laboratory, testing laboratory at RITM, and the hospitals were also not prepared to accept cases of the COVID. And judging from the experience of other countries like China, where the lockdown, the number one purpose of the lockdown was to enable us to build our capacities. So the World Trade Center, the Rizal Memorial Stadium, all those were put up in record time. And the government couldn't have done those without the help of the business sector. I know a lot of Maynila, Solaire, you name it, Smart, Makati Medical Center, on others. And what's so heartening is that a lot of people, small groups, came out and moved forward and tried to do something to help us. Now, fast forward now, we have a lot of facilities. This is the newest one, and it will be the biggest in the facilities that was put up in record time. We hope to put up more isolation facilities, not only Metro Manila, but in the regions, because for some reason, the virus has started spreading in the regions as well, even as far as far away as Tawi-Tawi. And so, thank you very much. I will thank the BMD and all those who had a hand here. I'd like to thank also my NILAD. Meron silang reps dito, si Annette, and some of the my NILAD people. And hopefully, the curve of the virus is flattening. We hope to bring it down to a little bit more. Last night, during our meeting in Malacanang, I think the target is to bring it down to 3 digits, because we are now at 4 digits. Yesterday, we had 3,073, but it's hovering between 2,700 to just over 3,000. So that's a good sign. Now, we believe that the people, the Filipino people has finally learned to live with the virus. They know what to do, and they are doing it. So I would thank everybody for the cooperation in trying to curb this virus. Maraming salamat po at magandang umaga sa inyong lahat.
Thank you very much, Secretary Lorenzana, sir. At this point, we are honored to have with us the presidential spokesperson, Secretary Harry Roque. Let us put our hands for his message.
Thank you very much. At good morning first to all of you, and of course to Secretary Delphine Lorenzana, who is my idol in the cabinet, Secretary Vince, who is my brother in the cabinet, and Yusek Sedain, hi sir, and of course, Architect Rizalco. I met him 10 years ago when he was much younger in the home of his aunt, and of course, hello po kay Mr. Jocot de Dios. I'd like to thank first Solaire, Bloomberry, Prime, for this invaluable contribution to the fight against COVID-19. This cost 225, was built more or less in about a month's time, if I'm not mistaken, or thereabouts. 5 weeks, no? 5 weeks. Oh. And it shows that where there's political will, we will prevail. I have a very short message, and I'd like to address it to the critics of the government. Today, we inaugurate yet another project which is in line with the government plans on anti-COVID-19. We're already in the second phase of the National Action Plan. We're already drafting the third phase of the National Action Plan. Unfortunately, I regret that the opposition is not even aware of Plan 1, Plan 2, and Plan 3. Unfortunately, this is not the first facility that we built through bayanihan with the private sector. We have also renovated many structures in this very location. World Trade Center, PICC, Folk Arts Theater, Cuneta Astrodome, all to be used as isolation facilities. And yet, the opposition claims we have no plan on COVID-19. Eh kung ito po hindi kabahagi ng plano, anong tawag dito? All I ask, wag pong magbulag-bulagan, wag magbingi-bingihan, dahil pagdating po sa takdang panahon na ngayon pa lang, ngayon ganitong kaagay, namumuliti na kayo, baka isuka kayo ng taong bayan. But I do not want politics to come into the way. I'm here to profusely thank our partners in the private sector for their continued cooperation in the fight against COVID-19. So on behalf of the President po, thank you to Solaire, to Prime, Bloomsbury, Meralco, Maynilad, and of course, thank you to all of you for joining us in this truly momentous and historic event. Magandang umaga po sa inyong lahat.
Thank you very much, Secretary Roque, sir. Now we shall hear the message of the National Action Plan Against COVID-19 Deputy Chief Implementer. Ladies and gentlemen, Secretary Vince Dizon.
Thank you. Maraming salamat po. Una-una po, Secretary Harry, Secretary Del, Yusek Emil, maraming salamat sa tuloy-tuloy na pagtatrabaho. Of course, this would not have been possible without the very, very generous assistance of the group of Mr. Enrique Razon. Alam niyo po, si Mr. Razon po ay isa sa mga unang-unang nag-volunteer na tumulong dito sa COVID response natin as early as April, no, when Prime BMD built several facilities, the first of which was the Ninoy Aquino Stadium, which has treated so many of our COVID-positive kababayans since that time. They also built Rizal Memorial, and they also even helped us set up our swabbing facilities here in Metro Manila. And now this is the biggest one of 600 beds. So on behalf of the entire national government, the National Task Force, we cannot thank the Razon Group enough, especially Prime BMD, Jokot, Jeff, and the team for really building this in record time. And this will go a long way in our efforts, especially now that we are focusing on reopening the economy. And isolation facilities such as this will really play a critical role in ensuring that we are able to manage COVID-19 cases as we open up the economy and allow more of our people to go back to work, to go back to their normal, quote-unquote, lives, even while we still try to manage and prevent the further spike in COVID cases. These facilities will serve a very, very important role. Apart from Prime BMD, I also would like to thank, on behalf of the National Task Force, the leadership of the AFP Medical Corps, led, of course, by Colonel Cardinosa, who is our Surgeon General, General Lim of the Philippine Air Force. General, thank you very much. And of course, the hard work of Dr. Colonel Shell Navarro and her team. Alam niyo po, they have been with us since April. They've been every day very quietly serving our countrymen who have unfortunately been infected by this disease. And we would not be able to control and manage our cases if not for the hard work and the sacrifices made by our men and women in uniform in the AFP Medical Corps. So, Sir Colonel Navarro, Colonel Cardinosa, thank you very much po sa inyong serbisyo. Also, DPWH, no, Secretary Mark Villar has worked tirelessly to provide all these facilities together with Yusek Emil Sidain, who is here. Right now, they are building a total of another 57 facilities just in the Greater Metro Manila area to help us manage the cases. So maraming salamat, Yusek Emil, sa lahat ng inyong sakripisyo. And of course, our other private sector partners, Maynilad, Miss Annette De Ocampo is here, and as well as Meralco. Finally, no, sorry po, marami tayong papasalamatan. Ang pinaka-importante pong dapat natin pasalamatan din ay ang Department of Tourism sa pamumuno ni Secretary Berna Romulo Puyat at ni Regional Director R.R. Makiling and the leadership of the Nayong Pilipino, because we are using the Nayong Pilipino land dito sa to very, very good use, no? And we want to thank Sec Berna and the leadership of Nayong Pilipino for allowing us to use this facility until we need it, no? Hindi naman tayo papaalisin, Sec Del, spoksari ng Nayong Pilipino at ng DOT dito dahil alam nila na kailangan natin ito. So with that po, I just want to thank everybody who's made this possible, and also to assure the public that all of these facilities will play a very critical role in our strategy of keeping and managing COVID-19 cases. And with everybody's help, we will, at the end of the day, we will all be successful in combating this disease and providing a better daily life for all Filipinos as we continue to battle COVID-19. So maraming salamat po, and again, thank you very much to all of you. Thank you.
Thank you very much, Secretary Dizon. Last but not the least, to render his message, the Department of Public Works and Highways, Undersecretary Emil Sadain.
Magandang umaga po sa atin lahat. Sec Larizana, Sec Roque, Sec Beans, Chair De Dios, Architect Lichauco, at lahat po na nandito. Good morning to all po. So basically, in the country's fight for COVID-19 pandemic, the national government has actually been relentless in all its effort to expedite implementations of all plans and programs to ensure a more sustainable and mitigating healthcare system, from testing, contact tracing, constructions of facilities, and treatment of COVID patients. Lahat po yan ay ginagawa po ng ating pamahalaan. These inaugurations and the ceremonial turnover of these newly completed 525 bed capacities, the Solaire-PAGCOR Mega Quarantine Center inside Nayong, Pilipino, is a clear manifestations of a genuine partnership, collaborations, and cooperations between the national government and the private sectors in pushing this COVID response. So this actually added to a total of 131 facilities. Yung sinabi ni Boss Beans, 57 that's already completed, and we are still plenty to proceed for constructions. About 131 of these, which account to a total of 6,000 bed capacities. So nadagdagan po ng 525 bed capacities under these facilities, and it's a great relief for most of the patients from NCR. But totally for DPWS alone under Sec Mark Villar, we are constructing a total of 600 facilities, which account to 24,000 beds capacities. Napakalaki pong facilities na ginagawa po natin ngayon in order to mitigate the effect of COVID-19. So no wonders po, things like this has been managed properly by the national government. No less than the President take the lead in the decision makings, the IATF, the NTF lead team to implement all these action plans really place us in a good conditions. So nevertheless, ito po ay tuloy-tuloy po ginagawa natin, ito mga constructions ng facilities. We know this can easen up most of our burdens even down to the countryside. So again, magandang umaga po at salamat po sa atin lahat.
Thank you very much, Undersecretary Sadain, sir. At this point, our media personnel will be given the opportunity to ask questions to our principals on the table. Once again, our media personnel are now given the opportunity to ask questions to our principals.
Good morning po to our panel. Greg Gregorio po from TV5. First to Secretary Roque. Sir, early this morning you were interviewed and you said that there is a 200% increase in the growth rate of COVID-19 cases in the National Capital Region. Maybe clarify this, sir?
That's very wrong. I never said that. They were asking me to explain the new classification basis of the DOH, which was growth rate and then the 2-week attack rate. So, in-explain ko na kapag 200%, that is high as far as the growth rate is concerned, tapos merong medium, merong low. Pero ang Metro Manila, wala tayo dun sa 200. I never said that, ha? Nasyak ako sa tanong mo, ha? I was saying that we are GCQ kasi pareho tayong nasa medium. Okay? So in fact, kung babasahin mo yung matrix ng DOH, ito, no? Ito, yung community decision matrix, ang high is less than 200%, ang moderate is 0 to 200%, ang low is 0%. Tapos, yung average daily attack rate, meron tayong low, under 1, 1 to 7, moderate, at saka high of less than 7. Yung attack rate nito is number of cases per 100,000 population. So, it so happens na nandito tayo ngayon sa moderate tayo, no? Yung 1 to 7 attack per 100,000 population, at saka nasa moderate din tayo as far as a 2-week growth period is concerned. So yung 200% po refers to high sa community sa 2-week growth rate. So I did not say that we have 200% in Metro Manila.
Thank you, Sec. I just
Oo.
had to ask kasi,
This was this morning in
Yes, sir.
IGAN, no? Hindi po, wala. In fact, bumaba nga po ang Metro Manila, no? And mamaya po, merong si Dr. Wong will guest in our press briefing to discuss precisely the figures of Metro Manila.
thank you, Sec. I just had to ask kasi meron din pong observation yung UP Octa Research Team na meron nga daw pong magandang trajectory ng
Maganda.
pagbaba ng daily COVID-19 cases
Maganda.
sa NCR.
Oo.
However, they also fear na with the movement of commuters ngayong extended ang GCQ until end of October, tapos nag-resume yung mga provincial buses, they fear na baka maapektuhan yung trajectory come December. How do we respond to this, Secretary? Maybe Secretary Dizon could also, or Secretary Lorenda. Thank you, sir.
Well, okay. At sa akin po, no, unang-una, yung mga bus transportation po na provincial is limited still, no, to Batangas, Laguna, and Cavite, where the cases are more or less the same as Metro Manila. So kumbaga, it is safe na hindi naman na tayo pupunta doon sa lugar na MGs na masyadong konti ang mga kaso, no. Pangalawa, meron po tayong protocols, no. Kinakailangan kumuha ng police clearance. Ano ba hong i-require ng police clearance? I-require din po kayo ng test results bago kayo mabigyan ng police clearance. So hindi kayo paalisin if you do not have a test result na you are negative for COVID, no? And then you will also sign a declaration na handa kayong mag-undergo again ng testing for COVID pagdating doon sa destination nyo if required by the LGU, or handa rin kayong mag-quarantine. So yun po yung mga protocols natin to make sure na hindi naman lalong tataas ang mga kaso. And of course, paulit-ulit na namin pong sinasabi yan, we need to live with the virus at pwede naman po lahat tayong magbuksan ang ating ekonomiya. Ang kailangan lang po, ingatan po natin ang ating mga buhay para tayo pong lahat ay makapaghanap buhay. I think si Sec Vince.
Opo. Sisegundahan ko lang po yung sinabi ni Sec Harry. No? Unang-una po, no, yung numero sa NCR at nationwide ay very clear po na pababa ang trajectory since nag-peak tayo nung early August. Nung early August po, gaya na rin ang sinabi ng UP Octa, nag-peak ang daily number of cases sa halos 7,000 nationwide. Sa NCR po, nag-peak siya halos 4,000 mahigit nationwide. Ay, NCR. Ngayon po, ang nationwide numbers natin ay nasa 2,000, more or less, ang 7-day average. Ang NCR po, nasa 1,000. At nung mga nakaraang araw, bumaba pa ito ng below 1,000. Nag-3-digit na lang tayo from 4-digit. So, clearly, from 7,000 average to 2,000, from nationwide, NCR, 4,000 to now, a little over 1,000, and we're even seeing it go down to below 1,000. So clearly po bumababa. Ang reproductive rate ay bumababa din, dati above 1, ngayon sa national ay 0.85. Ang NCR mas mababa pa, 0.74. No? So, pero ang kailangan na maiintindihan natin, kagaya ng sinabi ni Secretary Harry, ang COVID nandyan pa rin. Hindi siya nawawala. Hanggat wala tayong bakuna at medyo matagal-tagal pa yon, siguro mga first half of next year at the earliest, wala pa rin tayong immunity sa COVID-19. Ang problema lang po natin ngayon na mas malaki, kailangan na nating buksan ang ekonomiya. We have to slowly open up the economy because our people are suffering not just from COVID, but from the lack of jobs, from the lack of livelihood, from the lack of income. So, kailangan, nagsabi na ang Pangulo, kailangan dahan-dahan na tayo magbukas. And meron bang risk na tumaas ang kaso pag nagbukas tayo? Meron. Alam nyo, sa Europa ngayon, sa France, plus 16,000 cases in one day sa France. No, sa Europe, plus 50,000 cases on average, daily. So, ang buong mundo dinadaanan nito. Pero hindi tayo pwedeng makulong na lang no, sa takot. Kailangan dahan-dahan na tayo magbukas, pero kailangan handa tayo. At itong facility na binubuksan natin ngayon, ito ay kasama sa paghahanda natin. Na para kapag merong pagtaas ng kaso, ready tayong mag-isolate. Pero gaya ng paulit-ulit sinasabi ni Secretary Harry at ni Secretary Del, ni Secretary Duque, ang number one nating protection sa COVID-19 ay yung tuloy-tuloy nating pagsusuot ng mask, paghuhugas ng kamay, at pagdidistansya as much as possible, yung minimum health standards. Lahat yon, kung lahat yan gagawin natin at meron tayong capacity to test, to trace, to isolate, to treat, kakayanin natin to at dahan-dahan mabubuksan na natin ang ekonomiya para naman bumalik na ang kabuhayan ng mga kababayan natin.
Sir, last from my end, apart from reporting na we are still constructing, reporting that we're still in construction of thousands of bed capacity, kamusta po yung coordination with the hospitals naman para sa pag-convince sa kanila to increase their bed allocation for the critical care utilization? Last time we've asked them to increase from 30 or from 10 to 30% of their total bed capacity. Ngayon po, kamusta po, sir?
As it stands, the arrangement is at least minimum 20, no? Ang private. But we understand kasi that they have more limitations than government hospitals. Government hospitals were asked from 30 to up to 50, no? So, but our critical care utilization right now is not critical, it is below critical, no? On a nationwide basis, in fact, we are on the 50 plus, but in Metro Manila, we are at 60-something utilization rate, but still not critical. And this is because we are opening facilities such as these, no? This 600-bed isolation facility for mild and asymptomatics will, of course, greatly improve our critical care utilization because included in our count are not just ICU beds, but also isolation facilities.
Thank you, Secretary.
Good morning po, sir. Patrick De Jesus po from PTV. As of today po, ilan na po yung ating quarantine facilities at yung bed capacity po natin? At ilan pa po yung i-construct po natin?
Yung detalye, ipapasa ko kay Yusek Emil para sa details. Pero ngayon, ang capacity natin ngayon sa NCR at sa Greater Metro Manila ay roughly mga 28,000 beds. This includes LGU facilities, this includes facilities such as this, and it also includes the isolation hotels that we have commissioned. Pero like we said, kailangan tuloy-tuloy pa rin tayong gumawa. Kasi mas mabuti nang ready tayo at meron tayo kesa yung tumaas ang kaso at wala tayong gagamitin. Yun ang critical ngayon. Kailangan prepared tayo na mag-isolate at mag-isolate ng mabilis.
Thank you, Boss Beans. That's add-on actually the infrastructures done by DPWH. It's total 231 facilities and which account to about 5,000 bed capacities. But nationwide in totality, we are actually implementing 600 facilities. And about 300 of these will be completed towards the end of September, and the remaining balance will be by October to November. But aside from that, the department, with the call of the IATF-NTF, we are also helping constructing ICU beds. We call it the off-site modular hospitals. The first hospitals that we're going to construct modular type is inside the QI. Umpisa lang po natin on Saturday, and we'll be expediting this to complete before the end of this year. And this can account to 110 ICU beds for moderate to critical patients. So tuloy-tuloy po siya. There's also one inside the Lung Center compound. And there's also the Jose Rodriguez Memorial Center in Tala, Caloocan. Meron din siyang ganong hospitals. Aside from that, we will be starting soon the first modular dialysis center inside the NKTI, which can account to 50 patients. These are actually dialysis patients with COVID positive. So hiniwalay po natin yung non-COVID na dialysis patients with the COVID patients na for dialysis. So lahat po to ay katugunan dun po sa sinasabi po natin na National Action Plan ng buong gobyerno para dito sa COVID response po.
Thank you, sir. Second question ko po siguro para kay Secretary Lorenzana or kay Secretary Vince. Sa tingin ninyo, kailan po finally mata-downgrade ang National Capital Region into modified general community quarantine?
Actually, marami ng LGUs sa Metro Manila na gusto mag-MGCQ. Kaya lang mayroon pang mga iba din, I think about half, who would like to continue with GCQ para maplansya nila yung mga ginagawa para dire-diretso na. They're very afraid that if they loosen up, it will spike again. Babalik na naman tayo sa MECQ. So, I think 1 month more will not hurt us. It will help us a lot. Thank you.
By the way, no, dagdag lang din sa unang tanong. Nung height nung marami nating kaso nung August, ang capacity ng mga isolation facilities tulad nito ay umaabot ng 80+% on average. No? Ngayon, we're very happy to report, dahil nga bumababa na ang kaso, we are at roughly 50% capacity. But, like I said, paulit-ulit natin sinasabi, kailangan lagi tayong ready. No, kaya nga ngayon, we are taking this time na gumawa pa ng mas madami para pagdating ng time na kung tumaas man ang mga kaso dahil dahan-dahan tayo nagbubukas, ay mas marami pa tayong capacity ngayon kaysa nung nag-peak tayo nung Agosto. So, kumbaga sa Boy Scout, kailangan lang laging handa tayo.
Good morning, sir. Rafi Bosano po from ABS-CBN. Sir, magtatanong lang about the WHO briefing yesterday. Nabanggit po nila na may 120 million antigen test kits that will be available for low and middle income countries. Tapos ang priority daw po nun ay para sa mga hard to reach areas. Pero di ba po hindi natin siya ginagamit, hindi siya